A very warm welcome to all my viewers. So today we shall be discussing about POPQ. POPQ stands for Pelvic Organ Prolapse Quantification System. A highly requested topic. You all know this is a very volatile topic, and each time you actually do a POPQ staging for a patient, that's how you remember it. And recently I have been dealing with some of the prolapse cases, so I thought that yes, this is the right time to make a video about it. But this is a very important topic for the postgraduates who will be appearing for the practical exams, because some examiners do expect you to know the POPQ classification when you are presenting a prolapse case. This is quite a extensive and cumbersome kind of a classification, yet it is asked because it is very objective, which you will be subsequently knowing its importance in this video. So let's get straight to the topic. So POPQ, as I told, is a quantification system. So we are going to quantify and measure the exact prolapse sites. So the first thing that you need to understand is that what is the reference point here. The reference point in case of POPQ is the hymen. This is the first thing, important thing that you need to remember. Why hymen? Because the hymenal tags are easy to identify, whereas the introitus is sometimes very subjective, and it may be a little bit, it may recede inside, so you may not find it exactly. So here they have made the reference point as hymen. Yes, it's the same hymen which is very spoken about in our society as a as a marker of virginity, although it is not entirely true. A covering of the vagina with already perforations which allows the menstrual blood to flow through it every menstrual cycle. So it's not, and it can be torn in many physiological conditions also. So let's not get into the topic of hymen today. We shall be talking about it some other day, but the reference point here is the hymen. So what are the points? So basically you have 6 points to remember. First is the AA. AA is the anterior wall of the vagina 3 centimeter from the hymen. So suppose this is somewhere is the hymen, so AA is 3 centimeter from hymen. Okay, so it can range from -3 to +3. Now what are this minus and plus? Minus is anything above the hymen, whereas positive is anything below the hymen. So this is something that you have to remember. So this AA point can be -3 to +3. In a normal condition it has to be -3. So next is the BA. BA is the most dependent portion of the anterior vaginal wall. Okay, so most dependent portion of the anterior vaginal wall, what they have found out when this POPQ system was designed, they have found out in an arbitrary way that BA, which is the most dependent portion of the anterior vaginal wall, is roughly 3 centimeter from the hymen. So in a normal non-prolapsed patient, the AA and the BA will lie in the same point. Okay, but when it prolapses, then it can most dependent part of the anterior vaginal wall will be the most dependent portion of the prolapse. Okay, and that can be the TVL, that is the total vaginal length. So BA is from -3 to TVL, that is the total vaginal length. Next is the point C. Point C stands for the cervix or the vaginal cuff. Cervix or the vaginal cuff. So you can see this is the cervix, right? So this will be plus minus TVL. So if in a normal patient who doesn't have any prolapse, it will be inside. So it will normally correspond to the TVL, that is the total vaginal length. The total vaginal length is almost roughly around 8 centimeter. Some textbooks also mention 10 centimeter. So on an average 8 to 10 centimeter. So the C will be plus minus TVL. If there is a complete procedentia where the uterovaginal prolapse has happened, so this point C will be down, which will be corresponding to the total vaginal length. Always remember the whatever points I'm telling, it's with reference to the hymen. So please keep your imagination power alive, and you have to understand this concept. It's little tough, it's little cumbersome, but once you revise this video maybe 2 or 3 times, you will get a hang of it, and do revise it before the exams. Next, let's talk about AP. AP is corresponding to AA but in the posterior vaginal wall. So any, suppose this is the hymen here, so 3 centimeter above it, okay, from the hymenal point in the posterior vaginal wall is AP. So this again can be -3 to +3. BP in the similar fashion is the most dependent part of the vaginal wall in the posterior vagina. So the most dependent part of the posterior vaginal wall corresponds to BP. Again, this can range from -3 to TVL. Okay. Next is point D. Point D is the distance of the posterior fornix from the vagina. Remember that this point D is omitted if the patient has undergone hysterectomy. Okay, so if the patient has undergone hysterectomy, then you are not going to mention this point D. So in the case of like a walled prolapse, you are not going to mention point D. The later 3 points are easy to understand now. So first is the GH, that is the genital hiatus. Genital hiatus is measured from middle of the urethral meatus to the posterior hymenal ring. Okay, this is the urethra, this is your bladder, this is your vagina, okay, this is your cervix, uterus, and the posteriorly you have your rectum, anus. So suppose this is your, somewhere here is your urethra, okay. So from the middle of the urethral meatus to the posterior hymenal ring, okay, posterior hymenal ring, that is your genital hiatus, okay. So that's how they have marked it also. And what is PB? PB is for your perineal body. Perineal body is from the posterior aspect of the genital hiatus to the middle of the anal opening. Okay, so this is roughly your anal opening. So middle of the anal opening, mid-anal opening basically, from the posterior aspect of the genital hiatus to the mid-anal opening is your perineal body. Okay, somewhere here will be your anal opening. So mid-anal opening. Okay. Last is the TVL. TVL, as I told you, is your total vaginal length, and it can be plus minus. Okay. This is important to remember. So usually it will be somewhere around 8 to 10 in a normal individual. So these are the points that you have to remember. Now comes where we will plot this thing. One more important point that I want you to remember is that when you are examining the patient of a prolapse case and you are going to do a POPQ grading, remember all the points are done by telling the patient to be in a, by patient doing the Valsalva maneuver. That means everything has to be done when the patient has completely brought the prolapse part out. Okay, so it has to be examined or graded by the patient in doing the Valsalva maneuver, except the point D. So this is very important to remember. Except point D, which is the length of the posterior fornix. This has to be measured by repositioning the uterus completely inside. Okay, so there's all the points are measured by asking the patient to do the Valsalva maneuver. So this is a very important point that you have to remember. Then you are going to plot a table like this, where you have a grid. You have AA, B, AC, which corresponds to the anterior compartment. Then you have AP, BP, D, which corresponds to the posterior compartment. Then you have genital hiatus, perineal body, and the total vaginal length in the middle you have to write. Remember, genital hiatus and perineal body are always positive because these are measurements. Measurements can never be negative. Okay, these are with respect to a reference point, that is at the level of the hymen we take it like 0, and then we are seeing whether it is above hymen or below the hymen, accordingly plus or minus. But genital hiatus and perineal body are always positive. Now let's come to the grading. So once you have got all the points with the measurement, now you have to grade the POPQ. Okay, so once you have got all the measurements, you are going to see which compartment has which number. So the stages are basically based on the maximal extent of the prolapse relative to the hymen in one or more compartments. Okay, so it can be in the anterior compartment or it can be in the posterior compartment. So based on the maximal extent of prolapse relative to the hymen. Stage 0 is when there is no prolapse, that is the anterior and the posterior points are all -3, and the C or D is between TBL and TBL -2. Okay, so nothing has been prolapsed, everything is in its normal anatomy. That is stage 0. Stage 1, where the distalmost portion of the prolapse is more than 1 centimeter but above the level of hymen. Above a level of hymen, that means less than -1 cm. This is important to remember, because above the 1 centimeter above the level of hymen means it is -1. So but it is not in its -3 position also. So normally it should be -3. So somewhere between -1 to -3 it has come out. Okay, so this is stage 1. Stage 2 is when the most distal prolapse is between 1 centimeter above and 1 centimeter below the hymen. This is 1 centimeter above and 1 centimeter below hymen. So it will be -1, 0 or +1. Okay, so it can be either -1, 0 or +1. So if any of these are there in the most distal point of the prolapse, then you will call it as stage 2. Then comes stage 3. When it is more than 1 centimeter below the hymen, but not more than 2 centimeter less than TBL. Okay, so TBL, as I told you, is roughly around 8 centimeter. So 8 minus 2, 6. So now let's see some of the examples. These images I have got from the internet because they had nice examples which were available. So you can see that in this image the anterior wall is -3, cervix is -8, genital hiatus roughly measuring around 2 centimeter, perineal body 3 centimeter. TBL, as I told you, can be 8 to 10, so they have took it as 10 centimeter. Again APBP -3 and the posterior fornix measuring 10 centimeter. So this is what is a normal patient with no prolapse. Okay, so these all are the normal figures. Now let's come to the image F. Okay, so in this just to brush up, these points you will only get after you measure on your patient. Okay, so you can see that in the anterior wall it is +1. Again, the most dependent portion is +2, and the cervix is -5. Okay, then genital hiatus is 4, perineal body is okay 3, total vaginal length is fine. Again, anterior and the posterior walls it is -1, -1 and -7. So in this all you can see that the most dependent portion is the BA, which is +2. Okay, so if it is +2, as I told you, if it is, but the TVL -2, how much is TVL -2 here? TVL -2 is 10 - 2, that is 8. The most dependent portion is more than 1 centimeter from hymen, but it is less than TVL -2. So this is going to be a stage 3. Okay, so they have told the image shows anterior wall prolapse or cystocele, okay, which are +1 and 2, and they indicate abnormal pelvic organ descent. Okay, this topic was requested to me in a lot of my DNs, and even in my college postgraduates keep asking me. So I was having a very hectic schedule lately in my senior residency is very hectic. I was having back-to-back emergencies, then OPDs. So and I wanted some amount of gap to actually revise this topic myself and then make this video. You can find a lot of sources about this. Of course, you can read Shaw's, you can read Novak, where they have given in a gist about these topics, other practical gynec manuals which are available. Like these resources and try to concise it and make it easier for you. Any doubts regarding this topic, so please feel free to write it in the comment section. I'll be glad to reply, and stay tuned to the channel, and your any other topic which you want to request, you can write it in the comment. I'll be glad to make videos about it. So that's it for now. Take care and bye bye.